A 5-year-old girl is brought to the emergency department by her parents with a rash. She has been off school with a sore throat and fever over the last couple of days and a rash has developed over the last 24 hours. The rash is seen on the trunk and limbs and has a sandpaper-like texture. What is the diagnosis? Options are A. Roseola infantum, B. Rubella, C. Scarlet fever, D. Measles, E. Fifth disease. The answer is C. Scarlet fever. Initial clinical features may be nonspecific and include sore throat, fever, typically greater than 38.3 degrees Celsius, headache, fatigue, nausea, and vomiting. A blanching rash usually develops on the trunk 12 to 48 hours after initial symptoms before spreading to the rest of the body and flexors. A 67-year-old man presents to the emergency department with a 2-day history of left calf pain and swelling. He has no significant past medical history. On examination you note a tender, hot, red calf. You diagnose acute cellulitis. What is the most likely causative organism? Options are A. Staphylococcus epidermidis, B. Pseudomonas aeruginosa, C. Haemophilus influenzae, D. Staphylococcus aureus, E. Escherichia coli. The answer is D. Staphylococcus aureus. Cellulitis is an acute bacterial infection of the dermis and subcutaneous tissue. The infected area is characterized by pain, warmth, swelling, and erythema. Blisters and bullae may form. Fever, malaise, nausea, and rigors may accompany or precede the skin changes. Cellulitis most commonly affects the lower limbs, but other areas, such as the upper limbs, face, ears, and trunk, can also be affected. The most common causative organisms are Streptococcus pyogenes or Staphylococcus aureus. A 29-year-old man presents to the emergency department with a painful rash on his chest. He has no significant past medical history. He describes a tingling in the same area before the rash appeared. What is the diagnosis? Options are A. Contact dermatitis, B. Scabies, C. Shingles, D. Impetigo, E. Folliculitis. The answer is C. Shingles. Diagnose shingles on the basis of typical clinical features. There is usually a prodromal phase with abnormal skin sensations and pain in the affected dermatome, area of skin served by an individual nerve. The pain can be described as burning, stabbing, or throbbing, can be intermittent or constant, and may be so severe it interferes with sleep and quality of life. Headache, photophobia, malaise, and fever, less common, may also occur as part of the prodromal phase.